Hello, everyone. Welcome to another episode of Dr. Tashambi Speaks. I am Dr. Tashambi. I want to thank you all for liking and sharing to my YouTube channel. And I am asking you all, I know you all have to know at least 5 people that would benefit from the videos that I am putting together. So I would ask that you all would please share my video with at least 5 of your friends, and that will help my channel to grow. And I know that by the channel growing, it will benefit nursing overall, because the videos that I am putting together is really helping people avoid some of the pitfalls that they can find themselves in educationally and when it comes to their day-to-day practice. I also want to ask you all to consider joining Nursing Detroit. It is a Facebook community. There are 5.6 thousand nurses in Nursing Detroit, and I am telling you, we span the entire gamut of nursing. There are ICU nurses, OB, peds, nurse managers, all preceptors, clinical coordinators, nurses who are business owners, you name it, and it is inside of Nursing Detroit. So go on Facebook if you're interested, and I hope you are, and just ask to become a member of our community, and I'm telling you, you will not regret it. And also ask your friends to join as well. Like I said, there's a lot of information that is disseminated among our group, and it will benefit you. And plus, we have a lot of fun as well. So we work hard and we play hard inside of Nursing Detroit. Lastly, I do want to remind you all about licensure renewal. This year is coming up. For those who are on the even year, such as myself, just make sure that you have your contact hours in place. You have your paying contact hours in place. So if you are abstracted after the window closes for us to renew our license, all you have to do is put your proof inside of that envelope and send it off to the State Board of Nursing. And remember, as I have taught you all in the past, you want to make sure that you put your contact hours, those type of things. You want to make sure that your proof is in a secure place. And I think on one of my videos, I said you should put it in a fireproof box or a fireproof file cabinet. And that is the truth. So let's get started and talk about our topic today, understanding the role of the nurse preceptor. So I do want to put a little context into the role. I want to define the role of the preceptor. So a preceptor is defined as a relationship between an experienced nursing staff member and a newly hired staff member. The length of this relationship depends on the orientation period of the specific nursing unit. Now, dependent on the size of the nursing unit, there typically will be more than one nurse preceptor. I've even seen nurse preceptors on the midnight shifts, on the afternoon shift. So it doesn't have to be just one sole preceptor on day shift. Nurses in the preceptor role should possess the characteristics of a teacher. That is very important. Some qualities of a teacher. So let's look at some of the qualities of a good teacher. Think back on different teachers that you've had and what qualities were important to you. Some of those qualities are they should have good communication skills. They should be able to listen, collaborate. They should be able to adapt. Say if they're teaching you how to do something in clinical and you're having a difficult time catching on to what they are trying to teach you, they should be able to adapt and make changes in order to help you grasp that particular task. They should be empathetic. An empathetic person is someone who is caring and considerate, and they're patient with you. Those are some of the qualities that a nurse preceptor should have. I could remember one time we had a brand new nurse. She had just got out of orientation and we ended up having a cold blue. And I remember when I went into the room, it was her patient, and I thought, nope, you will not be participating in this cold. Because my goal was to preserve her. I didn't want her to feel like we were just throwing her out there. And we just put her next to the crash cart, and she was the scribe. She was the person who wrote down the events that occurred during the code. I felt like that was enough for her to be able to deal with since it was her first code. So those are some things you just want to be under the care or the tutelage of someone who is looking out for you. Other characteristics of effective preceptors include they should have an engaging presence. You shouldn't be afraid to walk up to them and ask them a question. They should have real world learning experiences. So they should have, been in different codes, as I just kind of mentioned a code a moment ago. They should have experience with things like that. It shouldn't be a situation where you're nervous and it's your first time, and then they're nervous and that's their first time. That's not good. They should be able to exchange best practices and practice best practices. They should also have a lifelong love for learning. Typically, they should be experienced and they should embrace the hospital mission, values, the protocols that are in place, and they should be willing to participate in evidence based care. Okay? So let's move a little further. So when nurses are in these roles, one of the things that we really want to make sure of is that they are in the role because they really want to be in the role. You don't want people just doing something just because they've been asked and they really don't want to do it, because what that does is it's not good for the person that's being precepted. The reason why I'm bringing this topic up, first of all, I had a conversation with someone about a particular preceptor experience that they're undergoing. And I also want to talk about this as well because June is approaching. June is the largest amount of newly hired nurses that we bring on board because they're graduating typically. In some schools, they're graduating in April, they graduate in May, and then the folks who have sometimes graduated in March and have taken their boards, all of those new nurses come on board and they're hired. I can remember one time we had like 75 brand new nurses that we hired, and within the healthcare organization. And all of those nurses each needed their own individual preceptor. So when this happens, there could be a shortage of nurse preceptors. And this brings me to my point. There could be a shortage. And when we run into shortages, or sometimes when healthcare organizations run into shortages, what they end up doing is placing nurses in the role of a preceptor out of desperation. And in some cases, they may not be qualified. The preceptor may not be qualified. So when I say not prepared, there are a number of factors that can cause a nurse preceptor not to be prepared or qualified to precept a newly hired nurse. So let's look at some of those factors. They might lack maturity. I'm not saying that a preceptor has to be someone who's elderly, but when I say maturity, I'm talking about they may lack the ability to not be a gossip, not be someone who's constantly late, a person who in their daily practice, they don't complete their care assignment. They've created workarounds or shortcuts when they're doing their patient care. They have poor attendance, and they may not be an overall friendly person. So those are just some of the examples. They may not fully embrace the healthcare organizations, associations' values and their mission. They may not be a friendly person, as I stated a moment ago. They might have a concept associated with how they believe a nurse should look. And when the nurse does not look the way they believe nurses should look, they may not be friendly towards that person. So this is important. This kind of can lead into why nurses eat their young. Okay, that's a phenomenon, and that phenomenon is real. So we have to be very careful as leaders and managers when we put preceptors over the brand new nurses. Maybe the person agreed to precept because the manager asked them, and they really didn't have the courage to tell the manager they didn't want to do it, which is their option. No one should be forced to be a preceptor on the unit, because I believe when that occurs, that's when the newly hired nurses can encounter situations that could make them not even want to stay with the organization. Another thing is maybe the person doesn't practice evidence-based practice. As I said earlier, they might participate in a lot of workarounds. And one of the things I would say as a new nurse, if you find yourself in this position, sometimes preceptors, they know when they're not ready, and they tend to avoid being around newer nurses, I would say, because newer nurses have been under the scrutiny and the tutelage of nursing instructors for sometimes 2 to 4 years. And new nurses, they've had the privilege of studying from the most up to date books. So even though the newer nurses may not know the organization, they might not know all the protocols, one thing they do know, and they have a nursing license to prove it, new nurses know the evidence based practice and the best and the newest way of doing things. And sometimes preceptors know that, and that can be intimidating to them as well. Sometimes preceptors, if the manager asks a preceptor to precept and they go along with it, maybe they're fatigued, maybe they're working a second job. Just because no one on the unit knows it, it doesn't mean that it's not occurring. There are people who have worked up 2 and 3 jobs and no one on the unit knew it, and it only becomes a problem if that person is asked to precept a new nurse and they are fatigued and they don't have the strength, the literal physical strength or the mental strength to orientate the person. They could be going through a life crisis. Maybe they have an ill family member. They might be ill themselves. So all of these are things that can make what should be a very happy time in your life as a new nurse. It could be stressful, but it's nevertheless a happy time. You finally made it. You passed your state boards, you've landed your job, and you have a right to experience the joy associated with those achievements that you've made. So I wanted to highlight some of those things just to kind of let you know what you can encounter. Ultimately, the goal is for you to have a good experience, but I do want you all to be equipped to know that sometimes these type of things do happen. If you experience any of these things, one thing you really must do is you must communicate with the hiring manager. Notice I said hiring manager, because ultimately that is the person that is responsible and accountable to corporate. And we're talking about the dollars, you all. Those are the people who are responsible to corporate. Those are the people who would have to answer to the fact that maybe a new nurse left before 1 year's time was up. And let me tell you, that is not good when that happens, okay? So I want to talk to you a little bit why that's not bad, why it's not good, I should say, is because it has been estimated that the cost to replace one new graduate nurse is between $49,000 to $92,000. That's a lot of money. The money that is lost during turnover, it can even be as high as $96,000. Turnover actually, it impacts the overall healthcare in the healthcare system in a bad way, because now you have less nurses and the risk of poor quality outcomes occurring is increased. And when I say poor quality outcomes, I'm talking about the need to maybe put patients in restraints more frequently. Patients could possibly develop pressure ulcers. Patients could experience falls. When these things happen, it causes the hospital to lose money. In addition to the fact that they have to go through the process of onboarding, hiring another nurse, and starting the orientation process over again. So please don't ever think that a manager is not going to be concerned when you have a conversation with them and let them know that you're concerned about your orientation process. Orientation takes a long time. Some of the reasons why orientation takes a long time, and it's different in different hospitals, and it's different depending on the particular service that you work in or the unit that you work on. And one of the reasons why it's longer is because people are sicker. People have sedentary lifestyles, they have a lot of comorbidities, and those things cause patients to become sicker. So a nurse could be hired on to work in the ICU, and I have seen where orientation, depending on where you are, it could be anywhere from 6 months to a year. If a person is working in the ED, you're looking at anywhere from three, I've heard people say as much as long as 6 months. You're getting all those different certifications. The hospital is investing all this money and all this time in you. And I'm telling you that if the preceptor is not doing what they're supposed to do, and if you are thinking about leaving, you really need to have a conversation with the hiring manager. Don't talk to the staff about your concerns. You want to remain professional, but you also want to wave your hand to the manager and say, I have a problem here. And I'm telling you, the manager will sit down and they will try to make it right for you. At least that's what I have seen. If they don't try to make it right for you, let me tell you something. That's a red flag. So before you go any further, you might have to stop and make some decisions with yourself, about yourself, and about your future. This is going to be more than just a notice that says part one, because this is a lot to deal with in a video. And so what I am going to do is break this up in pieces and parts just so I can make it make sense to you all. And on the next video, I do want to talk about the important qualities a preceptor must possess. And because I don't want you all to feel like it's doom and gloom, I never try to leave you on a low note. I do want to leave you on a high note, but at the same time, I do want to give you all information that can help you win and succeed as you progress and go into your new role. So I'm asking you all, like I said earlier, share the video with your friends. I know there are people that will benefit from the information that I'm sharing. And so I'm just asking you, just go ahead and hit share, send it over to some friends that you know, send it to a nurse that you know who might be going through some of these same issues, and I will greatly appreciate it. So until we talk again, just remember, if you have questions, send your questions to drtashambyspeaks@gmail.com. Follow me on Instagram at drtashamby. And I also want to ask you all to please join our Facebook, our Nurse in Detroit Facebook community, and you will not regret it. Until we talk again, you all stay safe out there.